Dr. Trevor, I want to be as healthy as possible and I want to prevent chronic disease. Well, what should I do?
Oof.
If kid has PANS, PANDAS, and the frontal lobe shut down, what are a few things they can do to increase activity of their frontal lobe?
Their frontal lobe? I mean, well, some of my
have that.
peers that I work with in the hospital, like I have these conversations with pertaining to like how they feed their kids and because their kids have issues.
Yeah.
And they're like, I can't do what your kids are doing. Like, there's no way I can do that. Like, I feel like I'd be depriving them of nutrients. It's just like, what? Like, is that for, like, they really think? All right, welcome to Second Opinion with Dr. Trevor Eason, yours truly. We're going to be jumping into a great conversation today with Dr. Josh Madsen of Infinity Neuromotor Developmental Centers, as well as a whole bunch of things that I think you're going to find extremely useful pertaining to those who are parents that have neurodevelopmental cascade issues, ADHD, OCD, high amounts of tics, different cascades that are just like kids that are just ramped up for no reason and always have these issues associated with some of the sicknesses they may have. So I hope you guys jump in and like the podcast that we go through today. And if you have any questions, just let me know. All right.
Yeah, Dr. Josh Madsen, I own Infinity Neuromotor Development Centers. We have a few of them. We have one our main one's in Des Moines. We have a second one in Minneapolis, and then a third one in Denver currently.
Yeah.
Work with kids from all over the world that have developmental delays, especially working on motor development aspects, doing not only rehab, but then functional medicine, functional neurology, and just really trying to get meeting every kid where they're at and trying to get the best function that we can possibly get from a motor standpoint, from an overall health standpoint, and looking at a lot of stuff we're going to chat about today, but in figuring out underlying mechanisms of what's going on and trying to get to the root cause of as much as we can for each kid.
Absolutely. And like some of the things we had talked about prior to coming on here were like, hyperactivity, ADHD symptoms, OCD symptoms, specifically child behavioral things that parents have to deal with on a regular basis. And I think we're kind of getting into the point where like there's also like all these different excitatory neural pathways that can cause a lot of controversy within these kids' brains, specifically to like a neurological and an immunological cascade that most parents don't know about. And most providers, like we'll talk about, don't really do too much in that schema other than just diagnose ADHD, diagnose OCD, just diagnose like, oh, he's bored or she's bored or something like that. But there is an underlying cause. And my first question for you today, and some of the first topics that we're going to talk about, is PANS and PANDAS. So from your standpoint, I know you're seeing a lot of this and you're kind of, niching in this a little bit more lately, but go ahead and tell the audience about what PANS and PANDAS is and then how you treat it and how you kind of work through that whole cascade.
Yeah. Yep. So PANDAS, a lot of people have heard about with that, basically getting strep infection. So it's pediatric acute onset neuropsychiatric syndrome associated with streptococcal infection. So they get a strep infection. That strep infection cross-reacts with their dopamine receptors, and then we start having things like OCD, anxiety, tics, basically things that from our basal ganglia, but these things happen really quickly, kind of overnight.
Of course.
And they start getting all these symptoms kind of out of nowhere. And then PANS is pediatric autoimmune neuropsychiatric syndrome, where that can be triggered from lots of other environmental things, other infections, viral infections, mold, heavy metals, environmental toxicities. They can trigger an autoimmune issue against these same receptors. And again, you will get, usually pretty quickly, you'll get a change overnight they'll start developing tics, OCD, anxiety. And like this actually happened in my own son after a mold toxicity. And that's kind of why I became so passionate about it, is because I've been able to see his transition from, really severe tics, really severe behaviors to over a couple year period to being back to completely normal. And, it was a big journey and I learned a lot through it. And so that's a big reason why I want to talk a lot more about it for sure. And also nearly every kid I've ever seen with autism, I'm not every single one of them, but a huge percentage of them, a lot of kids with ADHD, a lot of kids with learning disabilities, they have some form of autoimmune issue going on when you actually start to run the test and dig a lot deeper.
Well, absolutely. And I think like you're hitting the point on the head about like the immunological cascade when it comes down to like these kids, and there's always something underlying that's causing their immune system to be exacerbated. But you mentioned a few points that I thought were kind of intriguing, and you were talking about D1 and D2 receptors and that specific immunological cascade which affects the brain, causing that brain inflammation. Tell some of the viewers a little bit about what the side effects of damage to these receptors, like symptom-wise, would look like in their kids.
Yeah. Yep. So I won't get too deep, but when one of them gets affected, basically we can't calm down the brain. So we're stuck in like a go, 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 and we have no brake pedal, right? And so that's going to look like OCD. It's going to look like anxiety. It's going to look like repetitive activities. Think of their brains going too fast or systems are going too fast. And then the other system, when it gets the other dopamine receptor, when it gets dysregulated, it's going to look really slow. So it might be really slow cognitive processing. It might be just overall just decreased function, slowness of movement, slowness of thought, attentional issues. So they can have different effects, whether it's a D1 receptor or D2 receptor. But a lot of times, especially in this type of case, when we're seeing OCD, anxiety, tics, we're seeing more dopamine 2 receptor antibodies, and we're seeing more like antitubulin and
anti-myelin.
Anti-myelin in those types of cases. Maybe some Purkinje cell issues. But yeah, traditionally when you're talking about PANS, PANDAS, you're looking more at dopamine 1, dopamine 2, antitubulin, oligoganglioside, kind of like what a Cunningham panel would test as well. But we can go a lot deeper and look at a lot different markers with some of the newer tests that are coming out.
Yeah, for sure. So like talking to the parents out there, I think like one of the things that I know that happens on a regular basis, even though the American Academy of Pediatrics notices PANS, PANDAS as a syndrome and at least a real thing, still you'll find everywhere that doctors are like, these things aren't real. It's not this, it's just purely ADHD. And then they just give them a stimulant, or they give them an alpha agonist or something like that to not ramp up their sympathetics, but create some focus, like guanfacine or clonidine or something like that. Specifically, why would you think that this is a problem in that cascade?
What aspect of it?
So why is it always a problem if like there's another, like let's just say you, where like you have more understanding of this, you've looked into the research is there, it's up and coming, and showing physiological harm and damage to these aspects of the brain, specifically the basal ganglia. But then let's say like some other providers just like, these things don't exist. Why is that a problem?
It's a problem because they go, oh yeah, they just have ADHD. Well, they really have an underlying neuroautoimmune disorder that's I shouldn't say only, but it's traditionally going to get worse unless they treat it appropriately. And that's the problem, is like they're not looking at it from the appropriate mechanisms of the issue. And therefore, we're going to have a long-term chronic issue that could have been much better managed. Rather than just giving them a stimulant, they could be like, hey, this is an autoimmune issue. Well, now here's what's all the other things that we can do to help with calming down that neural inflammation, to changing their diet, changing their supplementation to support that. Here's therapeutics we can use to support that, active and passive things that we can do. This autoimmune issue is also going to affect their neurodevelopment. So what are things that we can do to reinforce appropriate development? And if you catch that early and you can work on that early, you can make a massive difference, versus we get so many people that come in that they've been struggling with PANDAS stuff for 15 years and they didn't find out till 8 years in that was the actual problem. They just kept getting pushed off. And like, yeah, even the American Academy of Pediatrics state that like when you're going to treat some of these things, like first line treatment are always going to be, antibiotics. And we can talk about doing an ASO strep titer. We can talk about a streptozyme. You can talk about doing anti-DNase antibodies and these specific things. Now, with that information, those things are obviously time sensitive. Yep. And most people don't look at it. We're just like, yes, well, you had a strep infection and it turned out to be better things. Because specifically in medicine, when it comes down to me, I think if a strep infection is not taken care of, it's going to turn into rheumatic fever, or it's going to turn into glomerulonephritis affecting the kidneys and all these other factors. I don't personally, I do. Most of my peers don't look at it as like, oh yeah, it's strep, it wasn't treated, like it's going to affect the brain too, right? And I think that like obviously it's a big problem because like you said, like if people aren't, or if parents don't understand that like their behavioral issues specifically within their kids are due to PANS, PANDAS, mycoplasma, strep infection, stuff like this, then they're going to go ahead and treat with stimulants. And then if you look at the safer treatment protocol, even from the American Academy of Pediatrics, which isn't that great anyways, it's saying like you would utilize stimulants cautiously. Yeah. And you would utilize it cautiously because the problem within these kids is they have these catecholinergic and glutamatergic glutamate and catecholamines just revving through their system. This is that D1 thing you were talking about, right? And I think like if you give somebody more of that, well, now it's not the same thing as what you would utilize in ADHD. Right.
It's completely different. You're throwing fuel on the fire. And this is why these kids don't respond to that. They respond to non-stimulant alpha agonists like guanfacine or clonidine and those things that are better. So I guess like from my standpoint, you take a whole person approach. You utilize all these different factors within neurology, within PT, OT services, bring it in the cascade, dietary, nutritional stuff. Yes?
Yeah. Yep. 100%.
So clarify a little bit more about like, we'll jump into the testing next, but like give me like an inclusion, or at least the audience an inclusion about like a patient comes in, has been diagnosed with OCD symptoms, 10 years old or so, doesn't matter if it's a boy or girl, having ADHD symptoms, OCD symptoms, poor behavior, some food sensitivities, likely had, an infection a while ago and nobody knew what it was, but they were super sick. How would you take this patient in and what would you do with them?
Yep. So first things first is figuring out, did we trigger an autoimmune issue against the brain? Do we have any autoantibodies against brain tissue? Run a neural zoomer. To do that, looks for 48 markers for autoimmunity. Also looks at the most common underlying infections that'll trigger that. So we can start looking at strep infections, different viral infections. If a whole bunch of stuff comes back on there, like that doesn't really make sense with the infections that are aspect that's present, then we know there's probably something deeper, like maybe some mycotoxins or heavy metals, environmental toxicities, run a total toxic burden there. Obviously run basic labs. We want to make sure that basic function's there, making sure they're not anemic, glucose isn't unstable, making sure the immune system's healthy, all those types of things. If you find an active strep infection, then there's lots of different natural antimicrobials that you can use. So that'll be one aspect. But if it's not getting better, then obviously we need to refer out for some medication. And we don't want that to be a long-term solution. Like we don't want them to be on antibiotics year round, right?
No.
And, and you can talk more to this of like a lot of times you can test positive for strep antibodies without an active strep infection, right? So like a kid will, maybe they have PANS, and what you have with that is you get these flares, and where maybe they're doing really good, but then they get a little sick or whatever, and they flare, or maybe they get a viral infection and they flare, and then their symptoms come back, and then they go in and maybe they had a strep infection, 3 months ago, 4 months ago, whatever it is, they test positive for antibodies to that, and therefore they go, oh, they have an active strep infection, let's give more antibiotics. And that has an anti-inflammatory effect and calms things down, but it's not, they probably didn't really have an active strep infection. And so like they're getting treated as if they just chronically have a strep issue.
Carrier.
Yeah. And where like maybe there's something else that's triggering that, and looking a little bit deeper to figure those things out. So that way we can keep that inflammation down. That's number one, is figuring out what's going on. What are all the pieces that are playing into this? What are all the other factors that are playing into this? Like in my own son, he had a mold toxicity. He also had a strep infection that I never actually did anything for, because once we got him out of the moldy environment, things calmed down. I didn't actually have to work on the strep. It eventually went away. We ended up finding out that he had high levels of BPA from new flooring that we put in, which is going to disrupt our system. We ended up finding out he had thallium, which I don't remember where that was coming from. I think it was our water. So we got to reverse osmosis and all that type of stuff. But anyways, besides the point, we found multiple different factors. And as we addressed all those things that decreased that inflammation, he started getting better. We got him out of the environment, started getting better, started adding a bunch of nutraceuticals in to decrease inflammation, started lasering him consistently, and then we did rehab with him.
Yeah.
And so that's the process of looking at what are all the pieces, and then what did that all affect? Like, did it dysregulate our mitochondria? Did it create a massive amount of neural inflammation? Did it dysregulate all of these neurological systems that are supposed to be developed at this point, like primitive reflexes, balance issues, eye tracking issues? And so number one is trying to address as much of the environmental aspects as we can, but then improving mitochondrial function, decreasing neural inflammation, and then rehabbing whatever got dysregulated. And that's where we see the end result being very positive.
Absolutely. And I think like some of the points you were hitting on is just like most people understand, like if there's a problem and that problem can be fixed with a solution, you bring the solution in. But most people, like you said, don't realize that if there's two countries going to war, a problem and a solution, or solution and problem, doesn't matter which side is which, they're going to come and they're going to do whatever, right? So what's going to happen is they're going to go to war, and then let's say everything's resolved and blah, blah, blah. What's left over? Damage, warfare, destruction, devastation, all these things. And this is what you're pertaining to in the sense of, maybe they had a strep infection, maybe they had this, maybe they had mycotoxins, maybe they had heavy metals, maybe they had environmental pollutants and all these other factors that came in and just, bombarded their immune system. And then we take those things away, but then we still have to come in and fix the environment.
To rehab all that.
Yeah, you still got to come in and fix the environment. And a lot of time people will need, some heavy amounts of neuro de-inflammatory and general de-inflammatory things to come in and help. Yeah. And I think specifically that most people, miss that component. And I'm glad that you guys are hitting that specifically because like we also know, like you mentioned 3 different cascades that always hit. Mycotoxins always, if you have the HLA, gene mutation, you're going to be hit with mold and you're going to hit with mycotoxin, and mycotoxin is going to affect your immune system.
Yep.
Some of the heavy metals, obviously we know if we have abundance of them, they're going to kind of clog our immune system. They deposit in tissue. They're very hard to chelate out. And then some of the environmental pollutants that you had mentioned. We're all exposed to these things. Now, pertaining to bacteria, viruses, those things just don't leave your body. Like right. Even with antibiotics, like viruses you can't kill. They're programmable. They don't die, right? Mm-hmm. They go into hibernation and then the immune system keeps them at bay. But if your immune system is taxed and it's not being focused on the current problems that could come in because it's focused on the chronic disease, actual stuff that matters, it's not going to do well. Now, let's jump in a little bit into some of the controversy within testing. Specifically, I know you mentioned earlier, like the Cunningham panel. I think the Cunningham panel has heavy amounts of scrutiny under it, and I think there's some better tests out there that test the same thing and have very high specificity and sensitivity as well.
Yeah. So
go ahead and talk about the Cunningham panel.
Every test, it doesn't matter what it is, every lab test has limitations, right? Like, and I think that's always important for people to remember of, even if there's a negative finding, there's a positive finding in itself, doesn't really necessarily mean anything because it's just a picture in time, right? They're important to get as much information, but it also has to make sense clinically with what we're seeing from a symptomatic standpoint, what we're seeing from a neurological standpoint. And when we make changes to try to address those labs and make changes there, does it actually physiologically change something? Mm-hmm. And so I think that's also just a lot of parents that I talk to, they're like, oh yeah, we tested positive for this or that or whatever it may be. Is like, okay, that's great, but like maybe let's look at a bigger picture. And Cunningham panel is again, it's a great test, but only looks at 4 things. It's super expensive, and it only looks at 4 of like the Vibrant Lab looks at 48 different markers, and it's like a quarter of the price. So like and also looks at a whole bunch of infections. And so like for bang for buck, it's like, well, that makes a lot more sense. And it can be done with a pinprick, which is awesome. During COVID, they changed that and they were able to do it as a pinprick, so now we don't have to do a blood draw. So for a lot of these kids that are, constantly...
Can't take that much blood off anyways.
Yeah, exactly. And also they're just like super anxious around a blood draw.
Yeah.
They can do all the kids sleeping on their toe and get enough. Yeah. So like, I think there's a lot of benefits to some of these other functional labs that are coming out that you can test a lot of stuff that just traditional insurance-based approaches can't do. No.
And we talked about this today. I mean, like the big thing, like I think that providers, going back to this, I think that providers are kind of handcuffed with, and they just have this idea that like this stuff isn't real or blah, 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 is because they don't have the autonomy to do so. Right. They are contracted with insurance companies, and these insurance companies get to dictate reimbursement, let alone what they can order, what's going to be reimbursed to the patient. And I can tell you don't want to be on the other end of like ordering simple blood tests on a kid or an adult or something like that aren't normal, that their insurance plan may or may not cover, and then they're getting billed at a hospital rate.
Yep.
And then the patients are getting irritated and pissy with you saying, listen, man, I ordered like 5 tests and it's $1,500. Like, why?
Yeah.
This is your fault. You should have done the due diligence. And, I think that providers are handcuffed, and I'll tell you, like in Tennessee, it's pretty bad. I don't think that providers are pushed hard enough. I mean, I just read a statistic the other day that said Tennessee is literally like the worst healthcare in the nation. I don't know if that's completely true or not, but I would say like if there's some notion to it, obviously that's something to be looked into for sure. But let's talk about some of the symptoms that would present with PANS and PANDAS. Though I know we talked about some of the OCD, anxiety, behavioral issues, but like in the cascade of criteria for diagnosis, we also know that like these are almost like choreiform movements. We know they have tics and stereotypies, and they have scripting issues, and they have all these other factors too, these are closely correlated with hyperactivity syndromes on the cascade of like, psychiatric diagnosis, but they are different in the sense. So let's jump into some of that stuff. And what are you generally seeing in your patients, and how do you kind of calm some of that stuff down pertaining to some of the hyperexcitability within the brain?
Yeah. So whenever it comes to PANS, PANDA stuff, it's usually started pretty abruptly. So that's a big, obviously part of a diagnostic criteria there. It started relatively abruptly there. But then they have to have, I have to look back on the actual diagnostic criteria. It's like there's 6 or 7 different symptoms. They have to have 2 or 3 of them that started, like OCD, anxiety, tics, repetitive activities, massive behavioral issues, blah, blah, blah. So it's not just like, oh, my kid's all of a sudden has behavioral issues and that's it. Like, so there's definitely more to it. But when it comes to calming them down, so big things that calm them down really quickly is changing their diet, getting rid of things that are going to cross-react with whatever aspect of their immune system's involved. So if their dopamine 2 receptors are involved, getting rid of dairy, getting rid of gluten, getting those things out of their environment. Obviously, getting out of an environment of, if they have ochratoxin A, that's going to cross-react with that. So getting out of an environment where they have mycotoxins or mold toxicities, reducing that stress on their body, number one. And also the psychosocial stress. Like that is a big thing that I was just reading a research study yesterday that I want to do a video over. And it was talking about psychosocial stress and causing leaky gut syndrome in kids that have PANS, PANDAS, or being correlated with that. So a lot of these kids going to school is really, really hard for them. And like I always recommend for those types of cases of removing them from that environment, homeschooling for a while is a really effective way to get them calm. I mean, every parent that does it, they go, oh my gosh, this year has been so much easier because we did that.
Oh, of course.
And it's just removing that stress, right? And so lifestyle stuff there. Therapeutics that make the biggest change by far is laser therapy. I love laser therapy for these kids. Dramatic. And I'm going to do another talk over this other research article I was reading. It was talking about our mitochondria get dysregulated with PANS, PANDAS, especially complexes 4 and 5, which red and infrared light or photobiomodulation for that is like one of the best things you can do to.
We're talking about like Krebs cycle, electron transport system, mitochondrial push.
Yes. Yep. We can utilize photons to upregulate those systems to produce more energy. The brain now has more energy. They can create more regulation. Sure. Really simple. And also, side benefit of it is decreases neural inflammation, which again is a mechanism. Decreases gliosis, decreases glial activation. So all these mechanisms we know are going on with a PANS, PANDAS, or a concussion, or any type of autoimmune issue against the brain. It's going to be a really effective therapy for. If it's done appropriately, appropriate dose, appropriate amount, by someone that knows what they're doing. I also really like hyperbaric oxygen therapy. Increases oxygen to our system, allows us to produce more ATP.
Yes.
Really simple. And then turmeric, resveratrol, omega-3s, making sure vitamin D levels are appropriate. Lots of antioxidants. To basically quench those free radicals. And those are, if you do those, I mean, typically a kid's doing a heck of a lot better. Then we can start rehabbing all of these neurological systems that got affected, like primitive reflexes coming back, inability to converge their eyes, inability to keep their eyes stable when their head and body moves, balance centers that are off. A lot of times these kids simply look from a neuro standpoint like they had a concussion.
Absolutely.
Pretty much did. So.
Well, exactly. And I think like what you're describing there is a chemical concussion.
Yeah.
And we know those chemical concussions happen because we know mild traumatic brain injury is a real thing. And when it does happen, if there's any inflammation between the gut and the brain, well, that gut inflammation translocates its way up to the brain, knocks on the blood-brain barrier, and squeezes in.
Yep.
And then we know macrophages are like, I wouldn't say this is derogatory to any profession, but it's like a physical therapist trying to go in and do brain surgery in the brain, right? Microglia are there for that specific reason. But when there's little tiny holes that are punched in and now we're having this cascade come in, now we have some issue.
Yep.
And I think that, pertaining to, I guess some of the mechanisms of why this works is because, and I would give this inclusion to parents, like if their brain's inflamed, it's not just like their brain's on fire. There is a little bit more detail to what actually occurs, and it typically has to do with their frontal lobes. And as we know with concussion, our prefrontal cortex, our frontal cortex, the front part of our brain, typically gets damaged, and it can be damaged from coup counter coup. It can be damaged because it's damaged. There's just plenty of reasons for it, but we know that mechanism is there.
Yeah.
Specifically because eye head saccades, which are basically eye movements and stuff like that, are always messed up in these patients.
Yep.
Now, pertaining to that, we also know that now, if the frontal lobe inhibition happens, meaning the frontal lobe turns off, behavior, logical sequencing, strategy, modification of behavior, modification of logistics and analytical processing and all these other things goes out the window.
Yep.
And that means that frontal lobe can't come back and talk to the system we've been talking about, which is the basal ganglia, and slow its roll. I think for parents, the simplest way to talk about your basal ganglia, which is the issue outside of the immunological cascade with this, is it's literally just a gas pedal and a brake.
Yep.
And it's literally like when you have PANS, PANDAS, or you have another hyperexcitability issue within that cord or in that part of the brain, the gas is just revving, right? And it's just revving up. And then you can obviously rev down too. But again, if you don't have that frontal lobe inhibition, then it goes back to your cascade of well, now, just like concussion, well, you can have primitive reflexes come back.
Yep.
The damage is there. You don't have that thing's coming down. And another inclusion, what I tell people is kids have obviously kids have an immature brain, and we know that. And that immature brain looks like this. If I have a kid that stubs his toe, it's they're gonna cry and think they're gonna die. You can't calm them down. Nothing that you do is gonna stop them from crying. It's terrible. If you have an adult do that, what do? They might muffle a few curse words and then they're on their way.
Yeah.
And that's the frontal lobe.
Yeah.
And we know that that's obviously damaged. So, I guess pertaining to, obviously we know that.
So let me ask you a question here.
Yeah.
If a kid has PANS, PANDAS, and the frontal lobe shut down, what are a few things they can do to increase activity of their frontal lobe?
The frontal lobe, literally, instantaneously, you always want to make sure inflammation is down first. Figuring out why that inflammation is there. Now, obviously, I can do different things. I would do similar things of what you're doing, hyperoxygenation. You can do laser. I can utilize, different types of NSAIDs and stuff like that in the medication schema. But again, you don't want to overdo things. And pertaining to this information, yes, there is a time period when you want to let that calm down a little bit. But when it comes to research and statistics, whenever the frontal lobe is damaged or irritated, regardless if it's chemical, immunological, or force trauma, you definitely want to get going quickly.
Yeah.
And you definitely want to make sure that they don't have stability. So if we bring them into the office and we're doing some neurological rehabilitation on top of, medicine, we definitely have to see what that threshold is. Every kid, every adult has a different threshold.
For sure. And
there's no point in jumping in and doing more than what they can handle, because you burn them out and then they're done for hours afterwards. But yeah, I think we also know that every kid that comes into your practice probably just doesn't have PANS or PANDAS. They can have these diagnoses and everything else that just really elevates the expertise that's needed in these cases. Yeah. So jump into some of that so we can kind of discuss a little bit more about how that impacts the entire PANS PANDAS cascade.
Yep. So on top of that, a lot of them come in, they have, a lot of them have allergies, a lot of them have asthma, a lot of them have, which is going to affect their oxygenation, which is going to make this issue worse. A lot of them have gut issues, obviously massive gut issues. A lot of them have celiacs. A lot of them have different genetic methylation issues. They have, there's just a massive list. A lot of them have thyroid issues. A lot of them, there's
autism.
Autism for sure. A lot of them learning disabilities. A lot of them have obviously attentional issues. We've talked about that.
Yeah.
And even a lot of people don't think of even kids that have cerebral palsy or have had maybe a stroke or had that's a very they had an injury, right? A very similar mechanism can happen where they can eventually trigger from that injury. They can start triggering these reactivities against these areas of the brain as well, and can eventually result into a PANS PANDAS type of case on top of an already injured brain from something that happened a long time ago. So that's been pretty interesting of looking at a lot of these kids of that maybe have cerebral palsy, and we run some of these labs. We find out they also have these autoimmune markers, and when we address those do therapies to help with that aspect, a lot of their motor coordination starts to improve, their muscle strength starts to improve, but it's a mixture of multiple different things, right?
Yeah, so you keep mentioning this whole topic of cross-reactivity, and I really want you to hammer on this, and I kind of have a point that I want to say on it too. But when you say cross reactivity pertaining to foods and how those foods can actually flare or calm down or whatever, these D1, D2 receptors, like help the audience understand a little bit what you're saying.
Okay. So when we get, like, let's say we get a leaky gut and we're releasing zonulin. That zonulin can open up not only our gut barriers, but our blood-brain barriers.
Yep.
And then what happens is, like, let's say we have a food that we're sensitive to. Let's just say it's dairy, right? And we eat dairy and we start to develop a reactivity to that. Our immune system develops antibodies against specific proteins. Those proteins have something called molecular mimicry. So they look a lot like other aspects of our brain. So that's like for example, our thyroid.
Yes.
Dairy can cross-react with our thyroid. So our immune system, the protein structure is very similar and starts creating an inflammatory / reactivity against our thyroid.
Correct.
Same thing, thyroid and our cerebellum.
Yep.
Very similar thing. So if we have a thyroid autoimmunity, it can start affecting our cerebellum because they have something called molecular mimicry, or they look a lot alike. Basal ganglia, same thing with, like, dairy is one that we know. Eggs can as well. Gluten's another one that can cross-react with that. Different molds can as well. There's probably a lot more, obviously, that I'm not thinking right at the second. But basically, our immune system is trying to, is reacting to this food over here. But consequently, there's areas of the brain that look so similar that it starts reacting against those areas of the brain.
Of course.
Does that make sense?
Absolutely. And I think it's a beautiful thing too, because like a lot of people, even like mainstream medicine, from like the standpoint that I guess like I'm, immersed in, is like there's a difference obviously between IgE, which are allergies.
Yep.
There's a difference between IgA and IgG responses, which are heavy sensitivities.
Yep.
And to be honest with you, I don't think that there's a lot of inclusion within that. And a lot of people would, and this, I have a big problem with this because I think food sensitivity testing is trash, to be honest with you. And I think it's trash because most providers don't order the right thing. Now, we all know that like when it comes to allergies are simple, right? If you have an allergy, you're going to have anaphylaxis, you'd have an EpiPen or some type of, H1 response where you're kind of like having that histamine come down quickly, or you're going to have a tragic response.
Yep.
Specific to that information, we also know that IgG and IgA are just sensitivities. Now, those can be minimal, moderate, or severe. And obviously, we know that when we introduce foods, even to kids very early on, like eggs, every child reacts to eggs, right? Or other foods, right? They get a rash or whatever. And the big inclusion about all this is people will order a food sensitivity test and just look at IgG and IgA. Why that's wrong is because it's telling you that there's a sensitivity response, immunological response, but what you also need in contribution with that, and there's better tests than just this anyways, I'm just using this as an example, is an IgG4. And IgG4 tells you that not only are you having an immune response, but your body's not going to do anything with that information. Meaning like you can have a very, very subtle response, but the IgG4 says like, we realize that this was a problem in the past, your immune system that is, but we're not really going to do anything about it. So you can continue to eat these things. The other cascade that's wrong with these tests is because they always come back with the foods you've eaten for the last 3 or 4 weeks.
Right.
And if you've eaten similar things, you don't have a lot of variety in your diet, they're always going to come back and say like this, and people are just, oh my gosh, I'm eating all these foods that are wrong and blah, blah, blah. They can create more of this cross-reactivity, create more of these things, and it's not true. I mean, obviously we have lymphocytic arrays and we have different types of testing now that's a little bit more beneficial, but still to the date, I mean, the elimination diet and reentry of elimination food is still the gold standard. Why?
Yeah.
Because it's always what people need. Now,
well, and to go off of that, even just to add a little piece to that is, like, we can have a gut intolerance that there's no way of testing.
No.
And so that's another reason why, just eliminating and then looking at what is the effect of that, even from a neurological standpoint. You can see if you remove that food and all their primitive reflexes start going away, they're probably sensitive to it.
Of course.
Like looking at all those other aspects of assessing that.
Mm-hmm. Yeah, and I like, it's one of those things too where I've gotten away from certain GI tests, and it's a great point that you made because, like, one, I don't want to tell people what I'm doing because there's people in my town that try to copy everything I do, which is unfortunate, but whatever. I guess copying is the best form of flattery, I guess. Either way, I've switched my test to get better sensitivity, better reliability, and specificity. But I guess pertaining to that information, it's what you mentioned before is we have something in our gut called secretory IgA. Secretory IgA is basically your immune system's response to certain things that come in. Now, if you have a bacterial infection or you have something in your gut, like I mentioned before, it's going to cause a cascade issue. It doesn't matter what the test says, a food sensitivity test, because as long as you do that, your immune system in your gut's tagging everything and anything. That's a pseudo food sensitivity.
Yep.
But
that's where you get your labs back and there's like 30 things on there.
Yes, and it's just like, I'm allergic to, no, you're not. Your immune system is tagging everything because you probably have an H. pylori infection or a Campylobacter infection, or you have something else going on, or, a parasite, which I don't even want to get on parasites because it's so wrong nowadays with the social media bull crap around it. But I think that going back to molecular mimicry and how this whole thing plays out is foods can cause issues, but it still goes further than just certain tests. Yes. Right. And I think a lot of parents are like, oh, well, you're just going to remove gluten and dairy and sugar. It's just like everybody does that. And everybody probably does. Why? Because they're inflammatory for most people.
For sure.
Are they all the time? No. You could keep broccoli, asparagus, and something else in your diet that's healthy for you, and it's still causing more issues than the other three.
Yeah. And we talked about this today of like, even just like foods that are high in oxalates for some people, they can't clear them. It can create massive amounts of inflammation where they can go eat all the dairy they want. It creates no issues.
Yes. And like everybody's different. Like there's no specific template or platform or anything like that works for every single patient. So like if your provider is doing the same thing on everybody, it's not that way. Now you can always start that way. You can start with a template, but none of my patients match it. Every one of them have something different. But the molecular mimicry thing, specific to the D1, D2 receptor thing, is highly imperative, right? Because if you can decrease the inflammation within your gut, well, you're getting a reciprocal event. Is that the fix? No.
Right.
It's just laying the foundation for creating a better environment for that individual to heal.
Well, and if you look long term, like let's say you have a gut infection that's causing inflammation, now you're releasing zonulin, that's going to open up your blood-brain barrier as well. Or same thing with asthma. Like let's say you have asthma or you have a upper respiratory infection. Same thing. It's going to release zonulin. It's going to open your blood-brain barrier. When your blood-brain barrier is open, now everything's crossing your blood-brain barrier. Now your brain is getting attacked from so many different things, it can't heal. And like that's why I think you're about to talk about this, of the importance of getting the gut to heal, getting these other linings to heal in conjunction. So that way you're just not having a chronic condition is so important.
Well, I mean, exactly. I mean, like most people's guts are destroyed. Why the food industry? I don't want to go down that on today, but like it really is one of those things where like, even if you think you're eating healthy, like when I was going through school, I thought Kind bars and all these other things were healthy, and they're just full of sugar and trash too. It's just like, you don't realize like how bad the food system is and how much damage it can cause. And even my counterparts that I work with in the hospital sometimes are like, listen, I mean, it's not a big deal. Like you can literally eat out of the vending machine and you'll be fine. There's still nutrients. And it's just like, that's where it's lost. There's different types of medicine. There's acute care medicine, which is beautiful. And then there's chronic care medicine, which you have all the opportunity in the world to tap into and learn. Because again, if you don't do anything with the time you have outside of the hospital, when you get to the hospital, it's going to be terrible.
Yeah.
And it's just one of those things that like it happens with everybody, yet nobody makes the change. And basically within our, a current medical model, the only screenings that we utilize as a preventative type of care are like colonoscopies and, mammograms and stuff like that. That stuff is in the word preventative is preventative, but that's trash.
Yeah,
I mean, like if that's the only thing we're doing to prevent chronic disease, that's trash.
Yeah.
That's not enough at all. And, it's cumbersome, but.
Ooh, this is a good question, so I'm going to stop you. Okay, this isn't related to PANS and PANDAS, it's just related to general health.
Yeah.
If you were to put together, what are the top things that you should do to be preventative right now for every patient? What should they do?
Cost is involved too?
Let's just say no cost is involved.
So basically, like, they can do it and it's free?
What's the best thing?
Best thing a human being can do?
Best thing that someone could do. Let's say you said, hey, Dr. Trevor, I want to be as healthy as possible and I want to prevent chronic disease. Doesn't matter what it costs. Well, what should I do?
Ooh. It's all these answers are going to be super, super cliche, but the research is robust. And that is scheduling something in your day first to make sure you can do it. And it all revolves around diet, nutrition, exercise, mental health, all these other factors that are free to people. Yeah. Yet they do not do it. And they will wait until it gets bad enough and they will go seek out a pill or they'll go to the doctor and blah, blah, blah. These things are so simple to attain. I can't tell you how important exercise is. Exercise is probably one of the most beneficial metrics that we do, except we're lazy.
Yeah.
The
Sure.
the American population and other populations are extremely lazy when it comes to that. They just, and I get it. I mean, I'm in that camp too. When I'm working 50, 60 hours a week and I'm like, I got to go work out, I'm like, I'm not going to work out. I'm trying to sleep. And like that in and of itself is bad too.
For sure.
You can't just work a bunch and expect your life to be healthy, but exercise, simple. Sleep is, gosh, I can't tell you how important sleep is. If somebody could, I'd make a wager. I'd wager probably, I'd put up $100,000 and I would say that if everybody followed a plan that I purported, pertaining to all the things I'm talking about, diet, exercise, maybe some gut health change, within 6 months, 90% of them or more would be 50% better or more, or I would lose that 100,000. I would put up $100,000 to say that just making simple changes like fixing your gut, getting better sleep, exercise, having better social groups, more than 90% of those people would be at least 50% better with heavy amounts of weight loss.
Yeah.
With decreased inflammation.
Yeah.
But they would have to do it.
Yeah. Which the diet, like I know what your diet is, like, you know, and it's not
Well,
easy.
not everybody has to.
Like, it's very easy.
Yeah.
It's not normal. So that
Yes.
like, you know, like that's the big difference there. If it's
Correct.
like, I see what you eat, and because I similar, not as strict as you are right now, but it's like, it's so simple, such simple foods. It's not hard. Like it's not expensive. Like
No.
it's super easy to do.
Well, and I think like what we're running, and I already know. I know like the psychological paradigm is the majority of weight loss schema in America.
Yeah.
Meaning like people can't get over the psychological hump. It's not the physical thing. It's not that people can go exercise, they can eat better, but it's the psychological cascade that, you know, burdens them.
Yeah.
And make sure that they don't continue. Because again, it's like anybody else. If you go do these things and you're paying attention, you're doing everything you need to do, but you only lost like 10 pounds, like everybody wants that quick change.
Yeah, they do.
And that's why GLP-1s are super, super fancy. And those things, trust me, those things are good for certain things, they're bad for others. But I would say that, and yes, like my dietary stuff is different and I do things for different reasons. And yes, I have Hashimoto's. Yes, I have some gut issues, not anymore. Brain clear. I want to function and feel my best every single day. Why? Because I work way too many hours and I take on way too many patients and I have to be on top of it all the time.
Yep.
And I'm aging every single day.
Yeah.
And I'll be honest with you, I feel like in the last couple of years since actually focusing on my health and not letting my career path just, you know, destroy me, I feel better than I ever have.
Right.
Like, am I tired a little bit? Yeah, but I still feel better than I'm not inflamed. I can think clear. I can go out and run 6 miles like we did this morning and be able to do it. And I have not run a mile in over probably 6 months.
Right.
So like, I know that I have the physical capacity to do so and not die at the end of it.
Yeah.
But that has everything to do with what's happening in here.
Right.
And like, if you do those things, then you can dramatically improve your health outcomes. I mean, it doesn't have to be hard.
It's not hard. Like it's, you know, and this is the same thing we see with kids of like all these kids that have PANS, PANDAS.
Yes.
I shouldn't say all of them, but the majority of them is they're missing all these basic things. They're sitting on a screen half the day, which number one, if a kid has PANS, PANDAS, they should not be on a screen at all. Like worst thing you could do. And most people don't understand that, how that affects your dopamine receptors. But sitting on a screen 3-4 hours a day. They're not exercising. They're not getting out. I mean, a kid, like a young kid should be moving 4-6 hours a day. Like, I mean, they should be moving constantly and developing their brain and body and eating whole foods, not eating packaged junk, eating actual meat and vegetables and fruits and good solid proteins and making sure they're getting all their basic nutrients they need. And that's, if you just start there for half of them, like I say this all the time, but if you start with those things, like they are gonna, just like any other person, they're,
Of course,
you know, they're gonna do well. A lot of the kids we see are overweight that have these issues, that their glucose is unstable, and they just, you know, the parents more or less, and it's not a blame on the parents. There's definitely mechanisms there, but it's like they're letting them have that. They're letting them do that instead of being the parent of like, no, these things have to change. It's
Correct.
like, oh, well, if you want it, if you
Exactly.
feel that way, this is, it's okay.
Well,
You
some
should
of my
have
peers that I work with in the hospital, like I have these conversations with pertaining to like how they feed their kids and because their kids have issues.
Yeah.
And they're like, I can't do what your kids are doing. Like, there's no way I can do that. Like, I feel like I'd be depriving them of nutrients. It's just like, what?
Yeah.
Like, is that for, like, they really think, and I think like it has been so psychologically warped from the food industry and how this is played out. Like, if you're not eating gummy bears, if you're not eating like fruit bars and fruit snacks, and you're not eating chips, and you're not eating all these things that are like processed and bad for you, then you're depriving your kid of nutrients. It's completely the opposite direction.
Oh, it is.
Completely the opposite of that.
There's no such thing as an essential carbohydrate.
No.
There's no such thing as an essential sugar.
No,
Like,
and it's just like how we've come to a different point in time where we think that whole foods cannot sustain us.
yeah.
Like,
it's
think
weird.
about that. That's insane.
The only food that actually comes out of the ground or, from an animal that can't sustain us.
Mm-hmm.
I mean, 1,000 years ago, that was, or,
It's the only thing that
hundreds
sustains
of years ago, that was the only thing that was there.
us. Well, I mean, like, yeah, I mean, like the stuff that's in food now, we know that it just depletes core minerals and stuff, and even medication does that. And I get on my patients all the time, and specifically if I'm prescribing medication in these cases, like there's always things that these medications will deplete, meaning I package them up, specifically like like blood pressure medication. We know that it's going to deplete CoQ10 and B6. You go talk to a pharmacist, they have a book in the back, they have to hold it by state law and guidance to say, like, if you take this medication and you ask me, I have to tell you that it does this.
Yeah.
People don't know that. And
Yep.
people wonder why, like, they started their lisinopril, and now they're on atorvastatin or rosuvastatin like 6 months later, because you've depleted all their CoQ10, you've made it so their LDL receptors can't respond correctly and everything else, and blah, blah, blah. The rest is history. So, I mean, like, there is good and bad in all types of medicine, and I think complacency has always been the problem. Meaning people get stuck in just going to a 9 to 5, and it doesn't matter if you're a medical provider or a construction worker, you just complete the task and you come home.
Yeah.
And I think like a lot of things can be missed, and it takes providers like us that actually care, that want to invest in the research, that want to invest in certain things. And, I think there's a lot of like, even specifically, like, let's just talk about PANS and PANDAS and wrap it all back up in that sense. When it comes down to that stuff, most providers think it doesn't exist because there's not heavy amounts of research to purport that it's unequivocally diagnostic.
Yeah.
Right. And we utilize things in research to, build certain things. Right. And give it 20, 30 years. I mean, I can guarantee PANS PANDAS is going to be in the DSM-5. It's going to be within the medical diagnosis criteria, and it's going to show all that.
Yeah. It's probably going to be one of the most commonly diagnosed
for sure.
pediatrics.
Oh, for sure. And, part of that, and that's the one thing that I don't really mess with is like PANDAS. Like, obviously I can prescribe antibiotics. I do it often, but I don't love to, just because I know that they destroy guts and everything else. But one thing I will not tolerate is strep infection without antibiotics. That stuff can be deadly, extremely deadly. And it's not just about PANS. Like I said before, it can cause rheumatic fever, enlarge your heart. It can destroy your kidneys. It can cause acute kidney injury. It can cause all these things that people don't know about. And kids are resilient.
Yeah.
But that doesn't mean that their body should have to deal with it.
Right.
Right. And specifically in this area, I would say like there's a lot of people around here that want natural medicine, and there's good and bad with that. But would you say that the majority of people that seek you out are very frustrated with the medical model?
Oh yeah.
Like they've been other providers, like this isn't this is just that, like you have no other option. And then most of the time I'm sure you're getting parents that are like, I've looked into this, I've researched this, I think it's this, and then it kind of curbs your idea to like, look into it.
Yeah, for sure. I mean that's just like the name of this podcast, Second Opinion. It's like they always, I mean, every single one of them, they've been here, and nothing's, maybe something's worked a little bit, something else worked a little bit, but that's the biggest frustration by far. Is like I went to my provider and he just shooed me off, and he didn't run any labs, didn't do anything, didn't look at anything, and like that's a big problem. Like especially when you start working with kids that have profound autism and like all these severe issues, and they don't even. It's crazy. Like don't even just look. Like let's just run a lab. Let's see let's see if the basics are there. Like, I mean, it's crazy. I see kids all the time that come in with super complex needs and no one's willing to do anything for them, which is so sad.
And like, I think the population sect that you're seeing and why you're making such a big change is because you do care. And like what I would say, like within my peers in the area, when it comes to the medical thing, if you have autism, if you're on the spectrum, if you're having these issues, you have one route, and that's PTOT, school assistance, all these other factors that come in, and then we got to do the best we can, right? And what you're telling me is there's more options, more solutions.
There is, and there's so much good research that supports like, hey, those kids have mitochondrial issues. They have energy production issues. They have neuroautoimmune issues. They have underlying gut issues. Like, those aren't new. They've been around forever. They've just, no one does anything about them.
Mm-hmm. And the thing is, like, you're coming into, I think we talked about this before, but like you're coming into an area and you're providing something and you're probably getting kickback from other providers. Like, what are you doing? Like, why are we doing this? Like, blah, blah, blah. I don't understand it. You're doing something wrong because it's out of their box.
Yeah.
Like they're stuck in this 4x4 box and they can't think. I get that. I get that often. But what I love about it is, and I just had a patient the other day, and I don't know if I was telling you or Jordan or somebody else about, they were telling, my patient came to me and said that their provider said that I had changed the lab markers. I did. And I'm like, well, where did you get?
Went into LabCorp.
I personally went in and, breached LabCorp's security, and I went in and I changed it because they actually got their labs from LabCorp. They got I didn't change anything. And it had everything to do with that other provider. Her PCP said that she was being referred out and diagnosed with a psychiatric condition, and she needed therapy and everything else because there was nothing wrong with her. There was clearly something wrong with her. All I did was run an autoimmune cascade, and she has lupus. She has lupus. And it's just like the provider started to tell her that this guy doesn't know what he's talking about. He's fabricated these numbers. How would I fabricate those numbers?
Yeah.
Like, it's literally like...
You just looked.
Man, that's just so frustrating to me. Providers do this because, specifically PCPs, because they're just referral trains anyways. And they do it because they think it looks better on them if they make up this whole fabricated lie. And in and of itself, it's a problem because it doesn't encourage change. What we are doing in our specific populations and the providers around, we're incurring change. Because if we set the bar higher, everybody has to come up to that bar.
Yeah.
And that's better for everybody.
For sure. It's better for the patient.
Better for patients, better for providers, better for standard of care. And maybe that whole statistic of Tennessee being the worst state for healthcare actually goes up, right? But if we remain complacent and stagnant, we're not going to grow. And I think, like, what's the harm? Like, what's the harm in, like, looking into the research, looking about photobiomodulation with lasers? What's the problem with doing hyperbaric? What's the potential and problem looking at mitochondrial disease process? And it doesn't have to be genetic mitochondrial disease processes.
Yeah.
Like, you don't have to have, like, these things that are in, Washington Book of Medical Procedures and our diagnostic criteria that we look at. Like, it doesn't have to be in there. They can literally be like, hey, their mitochondria is not functioning well because they're just messed up on all these other factors.
Yeah.
This immunological cascade.
Exactly. What's the harm in checking it or doing those things or even doing those therapies that have been shown over and over and over and over and over and over and over again over thousands of studies to be extremely safe? Like,
yes.
It's like it's crazy.
Well, I think it's the same thing that I'm talking about. Like, providers do not want to change what they do. They don't want something else to have to elevate them in what they have to do because change is scary for everybody. But, like, what is the harm? If it's safe, maybe we don't have randomized control trials. Maybe we don't have all this research to purport it, but, like, time will tell, and we will over time. But, like, I mean, it's the same old thing. They're like, cigarettes were safe and healthy for us. Are they? No, they're not. And it's just like, it's just insane to me that, like, people live in the now and they don't think forward.
Right.
And it's...
For sure. It's sad.
It's sad.
For the patient.
Yes, it's sad for the patient. And trust me, like, you and I both know of all people that parents are overwhelmed and they are distraught and they are without question questioning everything that they're doing and wondering like, what are they missing? If I'm not getting help here, there's nothing left. And that right there just is all hope is gone.
Yeah.
And it's not.
Yeah. There's so many other things. And that's, I think the big picture I hope people take away from today is like, oh, my kid was diagnosed with this, and therefore the doctor said that this is all they'll be able to do, or this is what's going to happen. And I can tell you over and over and over again, unequivocally, they're usually wrong. Like, especially when they put limits on the kid. Like, of course. That's what I mean. Like when the doctor says, oh, well, they'll never walk. They'll never do whatever. They'll never blah, blah, blah. Like we just had a kid in Minnesota. He's got a message from the other day, came into the clinic, wasn't walking at all, 3.5 after a severe traumatic brain injury. And within 3 days, he's walking 77 steps.
Yeah.
Like, and I know the other doctor said, well, we don't know what's going to happen. We'll see. Like, it's probably, they're probably, they may not ever do this, especially at 3.5. But those things with the level that they're at, yes, they don't know how to get there. But like, there is other people out there that do know how to do those things, that do know how to dig a lot deeper and find underlying issues that can dramatically improve function.
Of course. And we're definitely not sitting here saying that like this is the answer.
No.
Like we know that like patients are not going to 100% move into this, but it just takes the inclusivity to work off label, to be semi, creative in your treatment plans and not just follow by the book.
Yeah.
I mean, this is how medicine is expanded and how we learn. And obviously we do that through research, and you can find a for research over here and an against over here. We understand that. But the thing is, like, it's the best current available research, and we have to utilize it for our benefit.
Yeah, and, for sure. And the patient's benefit. Yeah. And 100%. Like, there's definitely people that come that can't help. I just can't.
Of course.
For whatever reason. There's too big of an injury. There's other factors that we don't know about, that we didn't weren't able to figure out. Like, there's definitely those things, just like any other provider out there. But that amount gets, the more and more we learn, the less and less that amount is. Like the amount of people we can't help gets less and less as you continue to grow. So,
so I guess with everything, like if a patient comes in and have been through the ringer and they've been everywhere and they said, this is just what you got, this is what you're going to have to deal with, how does Infinity Neurodevelopment or motor neurodevelopment, what is it?
Infinity Neuromotor Development Center.
Yeah, Infinity Neuromotor Development Center. How do you and your team in Denver or in Iowa or anywhere go in and change their mindset? Like, I'm sure like all these parents and whatever have like these questions, right?
Yeah.
And like, sure. how do you curb them? How do you encourage them? How do you build them up? And I'm sure it's not hard, right? Because they already don't have any hope anyways, and they see some of your videos or they see certain things and they're like, this is it, right?
Yep. There's so many people out there that say like, oh, well, you shouldn't give false hope. You shouldn't give whatever. And like, which I obviously try not to, but I think of it on the aspect of the kid of like, if you were a kid and I said, hey, you're probably just never going to speak, you're probably never going to walk, what's your brain going to do? Versus someone else who comes in, it's going to believe it 100%. It's going to be like, oh, well, this doctor who has this superior education level, who has whatever, just told me this, my brain's automatically going to go, well, there's no point in trying anymore, I guess.
Yeah, you put those restrictions on.
Yeah, versus someone else coming in and being like, hey, man, we got a lot of good things going.
Yeah.
We got some deficits over here. Let's get to work. Let's improve these things. Hey, we found out these other things that are also going to play into this. Like, let's improve those. Let's get your health better. Let's get, your movement better. Hey, you can't even move your head. You can't use your eyes independent of your head. Let's get those functioning better. Hey, they're doing well now. Those things are improving. And like, now you've created positive reinforcement. Now the kid, goes from, maybe they're starting to sit up. Maybe they're getting stability there. Then they're, able to stand, and they're developing that confidence. And then their own brain is starting to go, hey, if I work on these things, I can improve. Yes. And I think that's the most important thing, is not setting a limitation on a kid.
Yeah.
And because you never know what God has in store for that kid. You never know what abilities that kid has, or that brain has to heal. I mean, it's unreal what a lot of these kids have inside of them that they can't get out, or that the abilities they have that no one sees because they just didn't get enough activity to be able to, the appropriate activity or stimulation
at the right time,
or resources at the right time.
Yeah.
to improve their function. And once they get that, it's crazy what happens.
Well, yeah, I mean, like, it's just insane. I mean, like, it's a beautiful thing that this is available, and obviously we want many people to know about it, and, it's good. So let's kind of summarize a little bit. So, like, we've been talking a whole lot about PANS, PANDAS. We've been talking about some of the diagnostics. We've been talking about some of the therapeutics, how the immunological cascade comes in. I did have one common question that we kind of hit on, but we didn't really fully hit on. Like, you were talking about your son and how, like, he was having some issues with mycotoxins, some heavy metals, and some environmental pollutants. How often, and these are all validated by high sensitivity specificity tests.
Yeah.
How often are you seeing that is the key in stopping these flares within these PANS, PANDAS kids? Like, obviously we know flares. Anytime a kid gets autoimmunity to D1, D2 receptors, PANS, PANDAS, regardless of the infectious organism, we know that they're going to have a hyperexcitable state every time they have any type of immune system disruption. That can be from a sickness, that can be from a high flare, that can be from extreme exhaustion or fatigue, it can be from food sensitivities, cross-reactivity.
Yep.
Why and how are you seeing that these other constituents that we talked about, like chronic infection, chronic disease, heavy metal toxicity, some of these environmental pollutants, things we put in our body, are you seeing that these things are the main drivers? Or, like, do you feel like you have to get those things out of the way first for us to calm that down? Or do they need to be out of the way first before we do therapeutic treatment? Or do you do everything, like, together? Or is it just patient to patient?
I think the most important thing, so whenever, like, let's say we get an infection or whatever, we start triggering neural inflammation, dysregulates our mitochondria. So our mitochondria can't produce ATP. We can't influx and exflux sodium, potassium appropriately. So the cell starts to swell. Then eventually it bursts, creates apoptosis, which creates more immune system reactivity, more inflammation, creates that cascade that you're talking about. I think the first thing and most important thing is get energy back to the brain.
Yes.
Like so like for my son, I put him on a modified ketogenic diet to get more ketones, to decrease inflammation, have more energy. I started lasering him a whole bunch, got him out of the environment. So most importantly, got him out of the mold environment.
Yes.
I think that was the most important thing. We stopped, as many triggers as we could figure out, we stopped. We eliminated.
Yes.
And then I got energy restored. That was the first step. And then his tics got less and less and less severe. His behavioral issues got less and less and less severe. Of course, if he got an illness, he flared. If he got, if we gave him some food that we shouldn't have given him, he flared. If we let him watch too much TV or like a movie or, a show, he flared.
Of course.
And so it was more a parenting thing than it was anything else. It was consistency on our part to make sure that we didn't put him in a situation that was going to cause him to fail.
Yes.
And that was our own fault. In most of the cases where he was flaring the next day and it was really hard on us, it was our own dang fault.
Yep.
We created it, and it was us realizing that, okay, yes, he has a challenge and his brain is struggling right now, but it's our own burden to bear of we need to be the ones that say no, even though it's really hard to be like, yeah, bud, you can't be on electronic. You can't go watch that movie. You can't have that food that your friends are having.
Yep.
Like that's it's a bigger challenge for us than it is even for him. Like,
so you're saying, basically if we have somebody coming in, then it is imperative for parents to be fully on board and willing to sacrifice greatly.
Yes.
Yeah. Yeah.
And it's hard because it's your kid. You want them to enjoy these other aspects, but for the time being, those need to be limited severely.
Yeah, and we get that a lot at our practice too, where it's just like, well, they got like a birthday party coming up and they got summer break coming up, and I don't really want them to and I don't put kids on restrictive diets too often simply because of the nature of like development and maturation, and those things are needed, right?
Yep.
But if it's needed and warranted, then we do it under medical supervision, obviously.
Yeah, short term.
Yeah, short term. And specific to that, it's just like you kind of get these things. It's just like, well, do you really want your kid to be better or not?
Yeah.
Because again, like if you leave it, it could become more cumbersome and yada, yada, yada.
Yeah.
But I think that, one of the things that we see most often is just failure of, it's almost like daycare. Like parents come in, they drop them off, and then it's just like they get their therapeutic needs or something like that. But then you don't see the extra due diligence at home and modifying things. And those patients in and of itself are the most common patients that have the poorest results.
Yeah.
Because you can give the recommendations as a provider, you can give them everything to be successful, but they have to do it.
Yeah. And in these types of cases, they typically have to do it as a family.
Yes.
Like, honestly, for most of them, they should do it as a family because it's really general health stuff. Like the parents are going to lose a bunch of weight. They're going to feel way better. They're going to have more energy to invest back in their kid. They're going to be able to do more activities with their kid, get them out more often. Like the siblings are going to be doing better. It's going to create less stress overall. Like if everyone's doing it, and the kid also doesn't feel like, oh, now I'm different. Like,
Exactly.
oh, I'm different because my sister can eat this, but I can't. And it's like, well, no, she shouldn't have that anyways either. So like, or my sister can go play games, but I can't. Well, it's like, well, no, she probably shouldn't be doing that either. So it's like a lot of the things that are healthy for improving function. It's healthy for everyone. And
Absolutely.
you just have to be more strict. So I think removing those triggers as much as possible, figuring out what all of them are as much as you can, and removing them as much as possible is number one. Number two is restoring energy to the brain as fast as you can. And then number three is rehabbing. Like all of his primitive reflexes came back, so we had to rehab those.
Yes.
His balance systems were off. His eye tracking was off, so we had to rehab those things. And it took us a few different weeks of intensives to do that.
Of course.
So, and then when he would have really severe flares, sometimes we'd have to do another week intensive just to rehab what happened there. So,
of course.
But the more consistent we were, lasering him every day on, diet, lifestyle, all those lifestyle aspects, the less and less severe the flares got and the farther and farther apart they got. And it took 8-9 months to get to the point where he was having very few, if many flares.
Of course.
So,
yeah, and I think the big thing too, kind of tapping into like the medical side of things. Like obviously we know like the mainstay according to the American Academy of Pediatrics is simply this. It's antibiotics first if there's an infection that needs to be treated with antibiotics, and typically it's going to be a penicillin or azithromycin or something like that, or like a amoxicillin, maybe an augmentin, that cascade. Then you got steroids, then you got N-acetylcysteine. That's something natural you can do, but NSAIDs specifically. And that's not good enough because, again, you can't just give kids steroids all the time because obviously it's going to aid in their maldevelopment and, maturation when it comes to growth height and stuff like that. It also just kind of like yanks their adrenals so they don't respond well favorably either, so they can kind of flare everything. Some of the things that we get to utilize as well in the peptide schema and medication schema, and I'll talk about the meds first, is like we like to utilize like controlled dosing of low-dose naltrexone. Now, you have to be over a certain age. Now, you also have to understand, too, that like low-dose naltrexone is not the same thing as naltrexone. It's a completely depreciated dose, and there's always a modifiable dose, and we can compound this to whatever threshold we need to. Now, that helps extensively with immunological suppression. Low-dose naltrexone, unlike a steroid or a biologic or something like that, is not an immunosuppressant. It's an immunomodulator, meaning it helps your immune system not be so reactive to certain things, such as like a Th1, Th2, Th17, just, problem. And it makes it way more abrupt and better. I mean, what you were talking about before with like leaky gut and spilling contents into the bloodstream, endotoxemia, LPS, lipopolysaccharides spilling out by transecting its way up to the blood-brain barrier and cause that. You can stop a lot of that with things like low-dose naltrexone as well as other off-label uses. Now, we also utilize things like synapsin, which is a nasal spray. You can use vasoactive intestinal peptide, thymulin, which is extremely helpful for regulating the immune system, as well as thymosin alpha and beta. We also know definitively, and I learned this from a doctor in Chicago a long time ago. He was, I don't know if he was an epidemiologist, but he started working with a lot of these kids, and most of the protocols that I learned from him were great, but they were all peptides. Peptides are not medicine. Some of them are, right? Like GLP-1, that's obviously a medicine, but most of the peptides I'm talking about aren't necessarily medicine in the realm of prescription. And I think that those things are extremely beneficial, and I'm kind of encouraged that like we may be doing some of those things with you if need be, and like bringing that to some of your patients. And I think that it can be very beneficial. And specifically, there's other factors too. Obviously, if the kid's old enough or the adult's old enough or whatever, if they have these issues, we can do NAD drips specific to increasing the mitochondria as well, because we know that NAD is the main product of that. So I think that there's plenty of options when it comes to these treatment paradigms, and like there's obviously a lot of options pertaining to your preference, specific to like natural, therapeutic, medical, and everything else. And I think like there's a lot of kids and a lot of parents that have, kids that are diagnosed with neuropsychiatric hyperactivity disorders.
Yeah.
And they think that it's just that. I mean, I had a woman that came in a while ago that basically was diagnosed with ADHD, and she didn't have ADHD. She had PANS.
Yeah.
And it was just
100%.
like, it's definitively that. Like, she met all the criteria. She had some tics and stereotypies and other stuff. And I was like, this isn't ADHD, my friend. Like maybe you did a bunch of drugs when you were younger, but like, this isn't that, right?
Yeah.
So like, this is something different. And I think like even into adulthood, you can help people.
Oh, for sure.
Yeah, so no, I'm super thankful that you're able to come. I'm super thankful that we were able to sit down and talk about these concepts, and hopefully we can do it a lot more. I think that a lot of people are needing this type of information, and it's not like this is end-all be-all information. And like people can go find it, but it does come better when it's coming from two doctors.
Yeah.
So, I mean, it's obviously helpful to know that there's a lot of different options out there. We know that PANS, PANDAS are specific immunological / neurological related disease processes and psychiatric in that sense.
Yep.
We also know that there's heavy amounts of therapeutics, interventions, treatments, guidance that is available, and Infinity's doing that, and you're doing that.
Yeah, so are you, man.
Yeah, we're trying. But no, I'm encouraged. I'm always encouraged just because like my practice isn't fully set up to take on those advanced kids. Do we? Of course we do. And I think that it's invaluable. I mean, like you can really see, like I treated one kid, and he's obviously a friend of ours now, and like just to see him now, like it's literally incredible. And even it's very hard to please dads.
Yeah.
And it's not to say like dads are hard to please or anything like that. It's just like dads are kind of busy doing other things, and like, yes, they're invested in whatever else. And like most times dads are a little bit more skeptical than moms.
Yep.
And we understand that, but like his dad was just like, this is insane. Like I can't even tell you how much of a difference that we're seeing. And I'm sure you get that every day.
Yeah, for sure.
And it's just, it's a beautiful adjunct. So yeah, like I said, everything is out there, my friends. And I think that as we kind of clean up a little bit, what I'll ask from you, Dr. Josh, is, tell people where they can find you.
Yeah.
Tell people there's plenty of resources out there and everything else, and you can just let them know what that's about. Yeah.
Just look me up at Dr. Josh Madsen or on Instagram, easiest way. You can always DM me PANS1, and we'll give you our free guide for PANS type of stuff. And just love to help you in any way we can, for sure. Just a lot of people follow our content and learn a ton from that, and that's really our goal with everything we put out, is just hopefully we can help educate parents a little bit more on things they can do, whether they ever come to us or not. They can find other people that can provide these resources for them, I hope, locally. If they can't, then reach out to us.
Absolutely. Well, thank you so much, Dr. Josh Madsen from Infinity Neuromotor Development Centers all throughout the nation. Look forward for him. So thank you for having you on, and
Thanks,
look forward to next time.
For sure.
All right, man, we're signing off.